Hi, I'm Alan Green, MD, a family physician in California practicing integrative medicine now for 27 years. I'm the president of the American College for Advancement in Medicine, which is an organization that's been teaching doctors, amongst many things, the safe and proper use of chelation therapy, the treatment used to detoxify our bodies from toxic metals. And ACAM has been contacted a lot in recent weeks since the tragedy that has occurred in Flint, Michigan, because lead, as you know, is a toxic metal, and the chelation is the treatment of choice for detoxifying the body of lead. So there are many physicians who are concerned about the health of their patients and what should be done about this situation. Now, we understand that this is a very charged issue and that there's a lot of media attention on this topic. Most of what you hear in the media, though, is on the politics of what's going on and who's to blame and who covered things up and all of the media attention. There's been very little to none talking about the people who have already ingested this lead, have absorbed it, and already have increased levels in their body. And that's the focus that physicians are dealing with. And there are probably a lot of physicians in the Flint area who are questioning what should they do. And hopefully this discussion today will help clarify
that. My name is Dr. Wellman Schrader. I'm a longtime member of ACAM and head of the chelation committee at ACAM, and I've been a long-standing member and a board member for many years. And in my practice, we have done chelation for many years, and certainly lead is one of the big concerns now. And here in New Mexico, where I am, we actually see considerable amounts of uranium and other interesting radioactive metals that we have to deal with.
Dr. Doug Cutler. Live in Bingham Farms, Michigan. I've been in Michigan about 5 years, originally from Salt Lake City, Utah. So Michigan's grown on me. It's home now. And I have a passion in environmental medicine. I've trained under Dr. Krinian, Dr. Tran, Dr. Patrick, my mentors, and very familiar with chelation, not only in adults, but kids. I'm a big fan of the MSA, as I mentioned earlier, that I believe can basically save lives. A lot of work needs to be done, not only in Flint, but throughout our local communities, and I'm hopeful we can make a difference in this.
I'm Dr. Carol Wise. I've been in practice for 35 years. About 5 or 6 years ago, I got interested in chelation therapy and started using that in my office on a number of patients, basically as an alternative to treatment for hardening of the arteries. I grew up 30 miles east of Flint, and my practice is on the southwest side of Flint. I've become a number of my patients live in Flint, and we've been discussing the water issue and listening to the news. There was nothing said about the treatment, and I know there is a treatment for lead. EDTA chelation was designed to treat lead toxicity. And so at some point I realized that they were not going to be talking about treatment, and we need to get that information out, because there's a lot of people in the area that don't realize there's a treatment. All they're saying is that this is toxic, you're going to be living with the side effects. And so I called ACAM, and this conference is the result. What the health department is telling people these days is that, particularly for the children, that they want a balanced diet with high calcium, high vitamin C, and they're saying that this is going to prevent the absorption of the lead and help to excrete it. And that's not true at all. They are going to be, or they're sending things out and they're asking physicians to screen all children from the age of 0 to 6 years old that have been exposed to the water. And what about the other children? And there's been no talk at all about the treatment. Now,
Yeah, you know, and the other thing is it's not just children. Adults have been drinking this water too. And although children are more particularly vulnerable to lead toxicity, not only because they absorb lead much more readily than adults, but their brains are still forming, and we know that lead tends to settle in brain tissue. And the recommendations that you just mentioned, I believe, are wholly inadequate to deal with the lead that has already been absorbed. I think that's a really big problem that is not being handled yet.
well, and it's not just lead, I believe, that we're going to be having issues with. I have done a urine stimulation test on one of my patients that actually helped me set up my chelation clinic. She's a retired RN. And I did a DMSA, and I actually did a 24-hour urine collection on her. And her lead level was in the reference range. She has not been drinking the water, but she's been bathing in it. Her barium level shouldn't be higher than 5.5. It was 24.7. And her tin level shouldn't be higher than 2.25, and it's 37.99. Now, those things can be absorbed through the skin, and we in this area have known that Flint water has been contaminated for years and years and years. They've told patients, or they've told people not to eat the fish out of the river. And so using the river water, we're just seeing the tip of the iceberg. Lead isn't the only thing we're going to have to deal with.
Yeah, what other industries are upstream in the Flint River that could be contaminating the water other than just the lead pipes that are the old lead pipes that they're using? That's the good question.
It was General Motors. There's an old what's known as Chevy in the Hole plant. There are other GM plants. Some of them have closed down by now, but I was surprised at the barium. That's a heavy metal. I expect it's probably in the sludge of the river. There's a Professor Mark Edwards from Virginia Tech that has been testing water. I don't know if he actually tested the river water itself. I know they tested different homes, and I'm not sure exactly how all that came to be. I did speak with him, and he said that they ran a gamut of tests on the water, but I'm not sure exactly what all they looked for or exactly where all they looked.
Well, yeah, the scope of the problem. I mean, just lead itself has made all of this news. Imagine if many other chemicals are being found in that water, how much of a public scare this could become. And sure, we're just talking about toxic metals now. There are insecticides and pesticides and other industrial chemicals, obviously, that get poured into the Flint River. So, yeah, the scope of this problem obviously is bigger, and it's probably not just Flint, Michigan. because there are many cities around the country that get their drinking water from rivers that are contaminated. So this discussion really goes far beyond just Flint, Michigan, and it could be, applied to many other areas of the country and the world where there's contaminated water. We have to sort of separate what would be considered the usual and expected standard of care in the medical community in the United States, which is to do a blood level of lead. And then there are strict criteria that the Center for Disease Control uses as what is considered elevated. Now, the most recent guidelines is that if the blood lead level of a child up to 5 years old is 5 or greater, then that is considered elevated. And when that does alert public health authorities that someone should go to the home of that child and collect dust and determine where the source of that lead is coming from. But what is really inconsistent and doesn't make a lot of sense in terms of our understanding of the toxicity of lead is that the Center for Disease Control doesn't recommend that treatment for lead toxicity occur until blood levels reach 45. Now, we know from other studies that lead levels as little as 1 or 2 have been associated with neurologic deficits in children with IQ changes and behavioral changes. Yet 45 has been picked as the cutoff before doing chelation therapy to treat a child. And there have been really there's a dearth of information in literature about how low, if you have a child who has a level of 45 or higher, when you treat them, how low does the level need to go before you say you're done treatment? And that has never really been studied. And that's a big concern, because we know that, again, levels at 5 or less have been associated with health problems. So this opens up a can of worms, and it is a big problem that has been discussed in the chelation community for many years. When do you chelate a child, and what levels are you expected to go down to before you feel the treatment is finished?
Well, if you look at the CDC website, their face page says on lead toxicity, says there is no safe level of lead for a child.
That's right. There was a study done where children were given chelation therapy. If I quoted properly, if their level was greater than 45, they were treated, and when the level went down to 20, it stopped. And in that study, they noticed that it didn't make any improvement or any change in IQ. So because of that, they said, well, chelation doesn't work. But the flaw of that study, as you know, is that maybe it needed to go down to 10 or 5 or 2 before you'd really know whether it was working. And that study has not been done yet. So this is a calling, I think. The way I look at it is with a tight population of people in Flint, Michigan, where we know this is a concentrated problem, what better situation than to create a cohort of patients to do a study where we monitor and maybe be able to randomize a prospective study where some children get chelation and some don't, and look at parameters about IQ and behavior and learning disabilities and other health problems too, because we know lead doesn't affect the brain. It would be great if this study could be done right now. Well, from a chelating doctor's point of view, I think that we should do provocative testing whenever we think it's time. If you decide you're going to treat if a family, an adult, or if their children with their parents' permission choose to do chelation therapy. We would follow the guidelines of how you do proper use of DMPS or DMSA, and or EDTA as well. But that's really a decision between the doctor and the patient. How many treatments, how often, and when you follow up doing the provocative testing. The CDC does not use provocative testing. They just use blood levels. The use of provocative testing really is concentrated in physicians who've been trained in chelation medicine. And so, when I treat patients, there's sometimes a variation in how many treatments I give before I redo provocative testing. It depends on how high the level was, the amount of symptoms. So there's not an exact rule how frequently you do provocative testing. But that's, in my opinion, is a better test than blood lead levels, because that's more of a reflection of recent exposure. But chronic body burden of lead is something you would find out better from provocative testing.
And I think, I'd probably like to point out that short of intravenous chelation, there are oral forms that you just mentioned, buddy. DMSA being a notable one that's available to anyone pretty much, that they can use orally on kids with a great deal of safety. So it's not like when these kids have elevated lead levels that we have to jump to intravenous chelation right away. There are things to do, as they've told you, Yvonne. Certainly increase the protein, take large amounts of calcium and zinc. This will hopefully displace some of the lead and will be helpful. It's not the final answer. I think they're not giving you that, and certainly getting rid of it with oral chelation at first to see whether the levels drop to a reasonable level in your judgment and how the patient's doing. One of the big problems is we can't decide or tell you about a level in blood that you should chelate these people, adults or kids. You really have to go by symptoms, and it may be quite some time before these patients exhibit symptoms. So absent that, you really have to pick a level to chelate that you feel is safe with your patients.
Well, by the time a child has developmental delay or hearing loss, isn't it too late to reverse those effects?
Yeah, lead poisoning can cause permanent damage. But continued lead in the body, just because the damage is done, doesn't mean you need to let the lead sit there still. There are many other organ systems and increased risk for oxidative damage, cardiovascular system and the liver, and so we should still get that toxin out and hope to minimize future problems. But there is no guarantee that you're going to be able to reverse all of the neurologic damage that lead causes.
Yeah. So speaking of treatment, are we aware of anything that's going on treatment-wise in Flint?
I have not heard anything in the news, and it's on the first banner when I got on my Yahoo this morning to look at my email. The Flint, Michigan News was the top banner. It's in the front pages of the LA Times. You hear it in the evening news, and never once have I heard anything about how you treat what is happening to treat patients. It's how do you treat the water system, and how do you figure out who's to blame? That's all you hear about.
Right. So in the hospital, when that becomes toxic levels, they do treat with DMSA. Probably what they're seeing with the blood levels, they're not at those toxic levels, and they're not treating. So I believe that's where we can come in, and lead's still going to be a chronic burden, throughout their lives. And DMSA is, one of the easiest chelators to prescribe oral, and has a high affinity for lead, taking out the lead out of the tissues. So I'm a huge proponent of DMSA. It's very easy to use, low side effects, minimal, or pretty much non-existent for a lot of patients. And I personally use three tests. I use a blood. I test the lead or mercury. There's other metals you can test for, but I also use a two-part test from Dr. State, a pre-urine toxic metal and a post-urine toxic metal. And that way you can also measure current exposures with the pre-UTM, with the NHANES data from the CDC. So when you have those on board, you can really start to monitor treatment, obviously look at symptoms. My biggest concern, if I had these kids as my patients, would be just overall health. I'd be looking at gut health, since DMSA it's hard to absorb 100% of it. Probably 30-40% of it's only absorbed in a healthy individual. I'm sure a lot of these kids will have a lot of gut issues where they're not absorbing not only nutrients, but struggling with the DMSA. So that would be a big focus, gut health and healing up the gut, so they can actually benefit from the DMSA.
Yeah, I think most knowledgeable chelating doctors recognize that you don't just give the chelating agent. There are other nutrients, supportive nutrients that help the liver to, you give the conjugating factors and the milk thistle and things that help the liver to filter the metal chelate complex. And, if the child is not having regular bowel movements, we keep saying children, you have to think about adults here too. Lead is toxic in adults as well. So you have to have good gastrointestinal health to get rid of the metal chelate complex that gets into the bile and is released through the gastrointestinal tract. So, getting fiber and other liver supporting nutrients and probiotics, and keeping the lining of the gut intact so you don't just reabsorb metal back into the body again from the gut once it's been excreted into the bile.
You need to keep in mind the patient population too. Many of these are inner city people, and a lot of these children on Fridays, if they don't get a backpack with food, will go hungry for the weekend.
Yeah. This is tragedy. It is. For many reasons.
Well, trying to get them to eat a proper diet would be good, but how realistic is that? I understand it's important to get the gut healthy, but how are you going to do that? And, it opens up a whole nother issue.
It is not an optimum situation. That is true. And, the public health officials need to figure out the most cost-effective way of dealing with this situation. Chelation is the most potent way of detoxifying the body of heavy metals, and all of the other supportive nutrients. Maybe you could consider icing on the cake, but this is a discussion that we need to be hearing from public health officials too. And I'm not, involved in the whole Flint, Michigan situation. I'm wondering, what discussions are being had behind closed doors on the situation. So, at some point, it's going to hit the news. What do we do? And I think that's when there'll be an opportunity for us to put our 2 cents in as experts, physicians who've been trained and certified in chelation therapy, who have many years of experience, should be at the table in these discussions. and come up with a best solution.
One of the questions I had, buddy, and Yvonne may be able to answer this, or somebody local, is, you know, this whole thing has come up now, but did the company test the water before they started to distribute it to people? And I don't imagine that much testing was done in the way of heavy metals or lead, or chemicals for that matter. So that's a good question that I'd like to hear answered.
Well, I did hear something about the fact that they said it was tested and found to be within an acceptable range.
Before or after the issue, before or after the event? Do you know?
Yeah, I think if I recall properly, it was right around when they decided to switch the water system to the Flint River, that they supposedly tested it at that time, and because it was felt to be safe, they went ahead and continued to do it. I'm not sure if that's 100% accurate, but that's what I recall having heard in the news.
Well, what happened was initially when they started using the river water, it was badly discolored, and there were protests, and they talked about having used a particular chemical that they had tested that was too high, and then they supposedly lowered it, and it was supposed to be safe.
And the reality is that the vast majority of these people probably won't receive any treatment unless some public outcry is made and the treatment is given close to nothing or for free.
Yes. Again, all of this focus on lead, you know, if there are other minerals, other metals that are in the water that DMSA is not necessarily the best chelating agent for, yeah, that's another whole can of worms. So the best we can do is offer our advice and try to get public health officials more involved in dealing with the treatment part of this whole tragedy, and not just the pointing fingers political aspects of this. And you know, I think ACAM would be happy to participate in any way that we can in offering advice or wisdom on, you know, what we know and what can be done